welcome to The Sky's the Limit, and I'm your host Sharmeen Ali. Periodically throughout our programs, we feature renowned healthcare professionals, and today we're going to introduce you to such a healthcare professional who was not only known as a renowned pulmonologist in Islamabad and an ICU expert, but during this war against the coronavirus, he was one of the frontline healthcare professionals who treated thousands, hundreds of patients who've suffered from this illness. He took care of critically ill patients, people in the emergency ward, set up an ICU unit in the hospital where he is a medical director, Kulsum International Hospital in Islamabad. We are very, very pleased and proud to introduce you today to Dr. Shazli Manzoor. He is really one of our nation's heroes, like all the doctors right now who are on the front line of the COVID pandemic, fighting for all of us to keep everybody safe and healthy and to save those people who have coronavirus. And now with the new surge, it's extremely important to speak to these very unique individuals who put their own lives on the line for all of us. So this is to thank them and to acknowledge their efforts and their hard work. And I'd like to now introduce our guest for today, Dr. Shazli Manzoor. Thank you so much, Dr. Shazli, for taking out your precious time and being with us today. We know how busy you are with all the patients and all. Thank you for giving us your time.
Assalamu alaikum. Thank you very much for inviting me on your this prestigious program. I'm really honored and humbled. I think that I would like to first of all thank Almighty God that I'm sitting here today in front of you, and I was a part of something that I could deliver to the country and to our people, and what I have learned, what my experience is. And I would also like to, thank my parents who passed away, my late parents, and my family who were very supportive, my wife, my children, my sister.
You are a renowned pulmonologist, as I said when I introduced you. Everybody in Islamabad knows about Dr. Shazli Manzoor whenever they have, breathing, lung issues, etc., and otherwise also. So tell us a little bit about your beginnings. You're from the province of Khyber Pakhtunkhwa, and you find yourself here in the capital as a top doctor. So tell us how you got there. What inspired you? What made you begin this journey into medicine, and was it your family influence? Was it some experience you had where you decided, I want to be a doctor and save people?
It was very strange, and as parents, are always worried about their children. So the first thing that initially as a child that I listened from my parents was that I had to become a doctor.
Okay.
And from both my parents, so that thing went into my mind. And my father actually was an Air Force veteran pilot, and he fought wars, and we belong to KP. We are basically migrated from Bunair, from Pri Baba, and to Bajor, and then to Peshawar, and settled down in Nishtarabad. So my family actually settled, but because my father was in the armed forces, so our education was different parts of the country, starting from Peshawar, Sargodha, and going abroad, Saudi Arabia, and
what was your favorite place where you lived in an Air Force family where you've traveled around?
My initial days, my childhood, I don't remember a lot, but I think that most favorite was in Riyadh. And then when we moved to Rawalpindi, which is now the garrison, the corps headquarters, I spent most of my time. And my education was from FG college. Initially, it was the CB school and college, then it became a FG college and school. So I actually had all my up to FSC, my matriculation and FSC from that school and college.
And then medical school, how did that happen? Your parents had decided for you you're going to be a doctor. It was kind of fed into you since you were small. I think that's a good strategy. And now see where it's brought you. So definitely it worked.
Actually, I said in the beginning that I now think that you call me a renowned pulmonologist. I never had this idea. And now I think that whatever they decided for me, they were absolutely right.
It was right for you.
So my education then went on. I went to Pindi Medical College.
Okay.
I was a good student, but I would not say a brilliant student. I was hardworking, trying to be in the first spot in the class, and my father wanted I should be. So I was pretty good in that, and then I went to Pindi Medical College for my graduation. I graduated from Pindi Medical College in 89-90, and then I went to, I spent a house job. I did a house job in Holy Family Hospital for a year, and then I spent 1.5 years in PIMS. I did some cardiology training, and then one day I just decided to move to States. When I was doing, I was very close to my parents. I was the only son with one of sister, and she married and she was abroad.
So one brother and one sister.
One brother and one sister, and my mother never wanted me to go abroad, so I was pretty much attached, and I was the only son. But we went on vacation actually to Canada, where my sister lives, and my brother-in-law took me to a seminar. There was a seminar, and at that time I was also working at PIMS. I had a job there, a contract job there, and I was training in cardiology. And so I attended that seminar, how to proceed in medical education, further your studies, and I went there, and it was a seminar from one of the Kaplan Institute from States.
Okay.
And we just attended that, and I came back, and I told my parents that I want to stay and I want to go to States. So they were really shocked, and only thing my father asked was, "Tum kar loge? Will you do it?" So I said, "I will try." And that was the only communication that I had with my father. And so, one thing that I did was that they said okay, and I gave him the return ticket, and I said, just take this ticket away. I am resigning from the post, so that I should not have the opportunity to go back.
Sudden decision on the spot. Okay.
And so from there onwards, the real struggle began.
Oh, really?
The real struggle was that you're in a different place, in an alien country, and then you don't have those things that you had it in your own place.
The
your
pampering
home,
your family,
the house, the car, and all that. But the family was supportive and all that, and so I studied. I cleared my exams. We had hard time. We used to study more than 20 hours a day, maybe more on weekends and all that. And there were a lot of issues at that time with visas and all that. Going to state wasn't easy. And one of my friends was in States, and I called him. We graduated together, and when I passed the exams, he called me. We had interviews in States. And then I was selected for the residency program and fellowship program. So that was a pretty big struggle on my part in the initial phase of going, because first clearing the exam, and then to be accepted in a residency training, you don't have the green card, or you were not a citizen, never graduated. So you have to be at par at the same level at the Americans were. So then I did my training, and before my training started, I got married. My father wanted me to get married, so I got married, and I took my wife there, and so she was a pretty big support for me, and because I was on call every third day for 36-40 hours, I wasn't in the house and in the apartment, and but she supported me, and then I did one training. I did my medical training. I did my board in internal medicine, then I did my board in pulmonary medicine, critical care. So
how many years did that take?
I did like 6 years total training, but 3 years of my doing all the exams, and and 1 year I did research because I was a little late for joining any program, so I did research training. So it was, you can say, like almost 10 years that it took me to complete all those things that I wanted to do in...
so from a relatively sheltered background in Pakistan, coming from an Air Force family, from KPK, you went to the United States, and that is an experience on its own. It expands your thinking, wouldn't you say, and you turn into a different person, more open-minded and things like that. What would you say you took away from that?
Coming back,
other than the medical training, of course.
I think that you learn a lot. How people behave, how much civilized they are, their ways, and I think that I learned that. And then, Sharmeen, the good thing about them is that, if you go abroad, you have that finesse in your any profession, I would say. So I developed that. So they are very good in this whole medical field, and
the professionalism,
their courtesy, their morality. And so I learned all those, their attitudes, their commitments, their understanding of problems, people problems, patients problems. So if you go on, and their intellect, so I learned all that, tried to learn, I'm sorry, but I tried to learn, and I think that I was fortunate going there and learning a lot from there. And at that time, I was completing my training, and I had an job offers in States, and there was a job offer in Australia, and I was planning to go to Australia. I said enough for States, and I wanted to go in. And I actually came back from a little bit of vacation. I wanted to meet my family. I'm very, as I said, I'm very close to my parents, so every year I used to go and visit them, come home and visit them. So when I came back, I realized that I became a little bit depressed. So I saw them that they were lonely, they were growing old. So I said it's not fair that I should go and make money, and I would have a very better life, money-wise and status-wise, and
lifestyle,
all that. And
environment,
everything. Environment. And Australia was a very good place, and they were very good people. They had their guy who retired. He was a senior guy, and he had the same, the degrees, or same, like he was also a pulmonologist, a critical care specialist. So he was retiring, and they wanted me to join. And
the level of affluence that medical professionals have in that part of the world is
the
a totally
is a
different
and going
ball
to Australia,
game.
So that was a better opportunity, and so I called them, and I was thinking one day I just picked up the phone and I called them. I said, I'm sorry, I'm not coming, and you can offer this job to, thank you very much, and you can offer this job to somebody else.
Big decision.
Big decision. And they said, why? I said, because I have some problems, some personal problems. They said, okay, we'll give you a call in another 2 weeks, and they called me again. So I said, did you make up your mind? Are you coming? I said, I think that you can offer this job to somebody else. And they started probing me, and I said, see, I want to spend some time with my parents. I said, okay. If you want to join, you were supposed to join in September, you can come in December. We'll pay you all your expenses from States to Pakistan to Australia, and along with your goods and your family and all that, and we'll add some more into your
very
contract.
Attractive offer, right?
I said, okay, so, but inside, it was.
Couldn't you have taken your parents along with you?
I asked my parents. My father was, he said his words were always that, I born, raised, and I did everything for Pakistan, and I want to be buried in Pakistan.
So he refused to
He refused. I asked them, if you want to come to States, you want to come to Australia. My mother was always ready. She was, kind of lady who could, go anywhere, and she was very socializing and all that. So he said no. So then I called my father, and I told him that I want to come back. And as fathers are, he became angry and said, I'll tear down your contract, and why you're coming. And he was right. He said, you've spent a lot of time, you've struggled a lot. People think that doctors become like that, and they ask for, fee, and their fees. It's not like that. If you go back and see the time that the struggle that you have done, a doctor, coming to a level like that, it takes a long time, and
a lot of
studying. And then to get successful and renowned, it's another. Not everybody will get that opportunity in life. So he said, I'll tear down your contract, and you want. This is the time that you've struggled a lot, and this is the time that you should earn for yourself, and you should have a good life. So I could not say anything to him. So I said, okay, but inside I was not good. See, it was a tension that I could not leave my parents. What if the fear? There was a fear that what if one day I'll hear a phone call. I'll get a phone call that your father or your mother has died.
And you're
So,
far away and you weren't
yeah,
able to be
and
with them.
that phone call will probably wreak havoc inside me, and I probably would not be able to tolerate it. So I kept on, asking, and one day I just called my father, and I said can you do you eat 2 meals a day? I said yes, and I said, can you share one meal with us?
Right.
I said okay. I'm coming back. Khuda Hafiz, and I hung up. I could not wait for what he is going to say. And I then called the guy in the Australia, and I apologized and he said, we'll keep that job open and if you want to come. So that was another journey. I closed up everything. My wife was supportive.
A big move for the sake of your parents. What dedication as a son.
And then what I have learned from myself, I came back. I wanted to come back for 2 reasons. For my parents, simple. And one thing, whatever I've learned, I wanted to deliver or give something to our people, Pakistan.
That's wonderful.
So that was my two main objects.
And it's been how many years now since
I came back in 2002. I did not have a job. I came back and I called somebody and said, if you have a place, I will sit in the clinic. He said, you're always welcome. He's a doctor, and I'm always thankful to him. But one day I just drove into this place, Shifa Hospital, and I met one of their directors, and I introduced myself. And I had sent an application before, and they said they were very happy to have me, and they said, why don't you sign a contract? So that started my medical career in Pakistan.
Right.
And then what happened was that both the daughters were born in States. I got my labor certification, or I was close to getting a green card. But I refused. My lawyer called me that, you have to come back. And so I said, how much time I'm going to stay? And he said, maybe 2 to 3 years, 2 to 3 months.
There's a process, right?
I said, no, I'm not coming. So if you say that in Urdu, that I have burned all my, और मैंने अपनी सारी किश्तियाँ जला दी थी.
Right.
I could not go back. I should not go back.
Let me ask you this. Now, in this entire journey, okay, you came back in 2002, and then you've been here for now 18 years practicing. You made a huge name for yourself as a doctor. What other obstacles that you have had to face, either whether it was moving back or in the United States or just generally, because every successful person has these obstacles, and it's very important for our viewers to know that they have to be overcome, and they have to, there'll be hurdles, and you have to have that drive to just keep going forward.
See, there's a different you can say, in practicing medicine in States than in Pakistan. What happens is that in States, when you go and you join a hospital, the hospital pays you something, a good handsome money, and then they will arrange your clinic, and then so you're not worried about how many patients that you see, and whether you're going to get money or not, because it's paid every month, even if you see less number of patients or more number of patients. But the dynamic of medical practice in Pakistan is totally different. You have to have your name. You have to earn a reputation as a professional, as a person, and then you will be successful. It's not like that I have 3-4 degrees and I'm coming from States and I landed in Pakistan 2002, and then I'm here and people gathered outside to see me and want my prescription. No, so that was another struggle that started when I landed in Pakistan and started my practice.
To build that name as the big doctor, right?
So I was sitting in clinic, and one person probably will come in a day. I used to read a book, and then from one person, the 2 and 2 to 4, and it expands. And the word of mouth. I think the practice in Pakistan, I tell my junior colleagues the same thing, that if you want to be successful, you have to be persistent in your life, in your medical profession, and basically just what you call in the sabr, and you commit to your work. And you should be, my mother used to say a word, and that I have used in my profession, in my career, you should clear your, जिसे कहते हैं नियत को अपनी साफ रखो, and we should have that, you know, the rizq comes from God. Nobody can give you rizq. Nobody can give you anything. So if you believe in God, the faith in God, see, so
and
you know
patience,
that,
like you said
patience
earlier,
in
right.
your, and then you know there's no going back. There's no turning back, looking back.
Absolutely.
You know.
And okay, also in your profession, what do you think matters more for a professional? Is it their academic strength, like you said at one point you didn't feel that you were that strong academically, or is it their demeanor, or is it the relentlessness to just keep going on and work hard? What is it that counts the most?
See, Sharmeen, you have to be professionally very good and strong also, one thing. But your commitment to your patients, your attitude, how you deal with your patient, listen to them. It's the listening, the communication. So those kind of things that you can, they don't worry about your intellect. They don't want that you will be super doctor. See, my theory is that once a patient comes to your clinic, he will decide or she will decide whether she's going to come back or he's going to come back to you again or not. Right there and then.
True.
He will see you. So he will judge you. The patient will be the best judge, nobody else. So those patients and those judgment will bring up you as a professional in your life.
Anybody wanting to embark on your journey right now, young medical student or anything like that, what is the key advice you would like to give them?
I think persistence. Medical profession is very difficult. Not everybody in our class, in our when I was graduating, a lot of people have read that they can go to some level. But if you want to achieve something in life, in any profession, you have to be persistent about it. You show your persistence. So then you'll be successful. And definitely your commitment and your attitude. So those kind of things that you should
like in any other profession,
and then to be successful, to be a good doctor, definitely patient-doctor relationship, a rapport, a confidence that you have to build. So I think those kind of things will definitely, I will advise my young doctors to be, and the doctors who are coming back or who come back and they're young, they're starting practicing. I think that should be a good advice for them.
Right, okay. So now, coming to this stage right now, you were at Shifa, you mentioned hospital, and then you're here at Kulsum International Hospital as a pulmonologist, and suddenly, okay, you built up your reputation as a successful pulmonologist. Suddenly, we see the coronavirus spread all over the world earlier this year. In January, it was actually declared, and then people started to acknowledge it's there. Maybe it was there even before that, but in Pakistan, I think a little bit later than that, around February, March, actually people started to take it seriously. And then you started getting flooded with COVID patients. And at a time like that, where you already had everything, you were already a successful doctor and everything, you decided that you're going to be out there treating these very, very ill people and being right there, you know, frontline warrior on the war on COVID. Tell us a bit about that. What made you do that? Many doctors didn't feel that they wanted to take that risk and endanger themselves, their own lives and their families, and expose them also. But you have still been there. Now there's a second surge starting here in Pakistan, and you're still here treating corona patients all over again. Please tell us a bit about that.
Let me take you a little bit back when I started practicing in Pakistan. At Shifa I started, and I built up a ICU there, a state of the art, and I closed a closed unit that I ran for many years. And I've seen the epidemic of swine flu over there. So I used to see a lot of patients. At that time also, if you remember, that was a pandemic. I had seen a lot of patients. Actually, probably the first patient that came to me, I diagnosed swine flu over there. So I had a good experience about that pandemic. And a lot of
pandemics in general. Okay.
That was a different, diverse of a disease that we saw in COVID-19 pandemic. And a lot of patients went on ventilators, a lot of pregnant women. I had so many patients, the rooms were full, but we successfully managed that pandemic too. But you know, if you remember the social media, and the media itself wasn't strong, and it wasn't like that if you go back 2009.
2009,
see.
right.
So that went away and successfully managed. So I had an experience. Then I went to another hospital for some time, built up their ICU. So eventually I came here. And then there was an influenza outbreak in 2017 and 18, if you recall, worldwide also. We saw a lot of patients on ventilator and all that successfully again managed.
Let me ask you this, what did you learn from those?
I actually learned how to deal with those kind of patients because it's a rare disease and it's a pandemic. And there's no treatment out there, actually. There's no treatment out. So how you handle them? Mostly these patients were very sick. We were treating them in the intensive care unit where I have the expertise. And then people used to be put on ventilators, and you know that they're going to die, the family knew. But Alhamdulillah, most of my patients, 99% of the patient did well, and they were discharged, and they still come to me. So I can tell you that that experience really helped me fighting the COVID-19 pandemic. So this came, we were seeing that this is going to come. But in March, when things started coming in, and fortunately or unfortunately, I had a couple of patients that I started seeing in my clinic. They were returning back from different places. Like one of the patients came from Spain, from London, and I knew that they had COVID-19. And I did not tell them, I treated them. And later on I told them, because I could not tell them, that will be a scare. No hospital was going to admit them, no test was available. So a fear started, a panic started. And we were discussing with our CEO, Dr. Salim, very kind of him, and then we have our Dr. Iqbal Saifullah, and we were discussing all along what to do. We wanted that we should start a COVID unit, but there were a lot of problems that we were facing inside the hospital and the patients that were coming to me. I admitted one or two patients, and then a couple of emails came that, you know, why you have admitted COVID. Like basically by social media, somebody said, why in your hospital there are COVID patients. And eventually they turned out not to be COVID patients, but, you know, other patients who were in the same vicinity, probably they thought that we were admitting. So initially I had heart problem thinking about opening a
negative reaction from your regular patients.
A negative thing coming from all over, the people around you, your professionals, your patients, your other. So
I do remember back then, people were starting to feel a little bit like, oh, should we even go to this hospital because the corona is spreading, and we've heard the corona patients there. So that also has an effect on the hospital.
Yes, so it was a fear to start with, a panic. Fear coming from us also, that if it spreads, then how we are going to handle it. We don't have any means, ways, treatment, how we're going to do it. If we fail, what will happen? We have to deliver. We have to do something. So if we fail, then people will start pointing fingers, you know, and failure means death. There was no other thing that you could see. So the panic gripped, the fear became high. But I kept on having meeting with our colleagues, with the administration. And then a time came when we finally decided that we are going to open up a COVID-19 unit, and I will head the COVID-19 unit.
Okay. And this was back in April?
In April. The first case that you remember were coming in March, and then in April we managed, and with our CEO, Dr. Salim, with Dr. Iqbal Saifullah and other teams, we decided and how to, you know, how to go about it. So then I had a meeting, and they said, we'll give you one floor and consisting of 16 beds. Those were state-of-the-art beds. We could turn them into an ICU unit, and we'll make a triage system with the other patients coming from other, because, you know, more worried the hospital, the patients, people, the other doctors were worried where their other patients are going to go. So made a system, a triage system that, you know, we ask a couple of questions from the patients, and then, you know, they'll go to a COVID triage where they're going to be assessed, where the patient is going to go. The ER was separated, where the COVID patients with COVID symptoms will come, how to deal with them, the nurses. So we had a meeting then one day, And I actually called a meeting with my junior staff, doctors, with paramedical staff, the nurses. And I told them that I'm going to open up a unit, and we need your help. And I am, this will purely be a voluntary, you know, asking a voluntary, your...
So none of the doctors were required to
None of doctors were
work there, or
pressurized.
nurses, but there was a choice.
No, nurses, even paramedical staff.
Well, you don't even see that anywhere else in the world.
No,
They're
so
mostly
I just said
required,
them,
right?
and they said, I said, I'm going to lead you. And yes, they are feared, they panic, you can get sick, you can die.
So you led from the front.
So I led.
How were your, after all of this, we'll talk about everything, but how were your doctors and nurses?
Yes,
Were they safe?
so they, a couple of them, very few of them said, you know, we don't want to work, and my father will not allow my mother, but very few. But most said that, sir, if you are going to lead us, we'll be with you. And my nurses, I salute my nurses, my doctors, my paramedical staff who were with me, the hospital staff, the administration, Dr. Iqbal Saifullah, Dr. Salim Khan to be mentioned here, Dr. Mehdi, our administrator, that they were really very helpful and supportive on my actually creating a COVID unit. And you know, this was not for something that we were looking as anything else, but to give something to the community that we can.
Absolutely, because it's a private hospital.
It was
you know,
private
you can
hospital.
do anything
We
you
can
want.
do anything.
Yes.
We would just label it no COVID-19 patients.
Yes, exactly.
And that's it. And so then we opened up a COVID-19 unit. I went to my family, and we had a chat, and my two daughters, and they said, if you have to do it, this is your profession, then you have to do it.
Wow, that's brave.
So
That's brave.
as I said, that my wife was supportive, both my daughters, and I am thankful to them. And definitely it was a war that you could see coming in, and see, probably one day you will not be there, and you will come to the same thing that the other people were going through.
Okay, so in this ward that you opened, the unit that you opened, how many patients approximately did you see, and what was the success rate?
Sharmeen, in no time that the word spread that I have opened up a COVID unit, it was initially we opened with 16-bedded ICU. It was a total ICU bed, and we totally separated. The lift was different, the entrance was different, the staff was different. Provided them with the kits, the PPEs, and at that time we didn't have much actually to begin with, but the hospital really made their effort to give all the things that we wanted. So it was 16-bedded, and then we added another 2 beds, and so this war, this thing started against the pandemic.
And you treated several hundreds
I
of
treated
patients.
several hundred patients in the COVID-19
With the
unit.
relatively high success rate.
With the high success rate, yes, there were deaths, there were problems, there were complications. But I think that the way that I was seeing, the fear and the worry that I was telling you in the beginning was that if a country like States, the USA, or any developed countries whose health system is so superior that I've been there and I've seen them, that failed, how we are going to be successful? That was a big question mark.
And then you heard at that time about a lot of doctors and nurses losing their lives.
Yes.
Did you have that experience?
Yeah, we had it. We had that experience that 5 of my best nurses actually were diagnosed with COVID, and they were actually admitted in the same unit that I was leading, the same nurses, and they got pretty sick. They were all young. And one time I used to think that what if I'm going to lose them? So eventually they got better, but there were a lot of stories like, Sharmeen, there was one room that there was a son, and another room close by is a father or a mother, or a brother or a sister. They cannot meet each other. See, and so it was scary. And there were days that I used to become emotional and used to cry. And then sending one person back to their family, to the community,
was not going to make it.
Was a big difference. See, and that used to make us happy.
Oh.
And used
So
to
sending back the one who's
see,
recovered.
this was an
Right,
adrenaline
okay.
rush. And there were stories like one patient came to me and he had a pneumonia. His sister sent that patient, his brother, to me. She knew from somewhere that I was treating. He had a stroke also. And he came and I admitted him, and he had a kidney failure, stroke, pneumonia. And later on, after 5 days, the same sister came and I saw her in the ambulance. She was dead from that corona.
Right.
See, I could see a father die. I could see a mother die. People used to wait downstairs, waiting for me to tell them about their family. There were unfortunate deaths which still haunt me. See, but you cannot, people were old with medical problems, but very few deaths. I cannot ignore them. But mostly it was successful.
What would you say amongst your corona patients, what was the key to survival, the ones who did make it? Now, there was a common belief that it was the elderly who were, had a higher mortality rate and all. What did you actually see?
I admitted patients who were in 30s and 20s, in 40s, and people who were old. The people who were old with medical problems, they did worse.
Okay.
Yeah, they did worse. And
Right.
people who were coming late for medical attention, you know,
Late in the
seeking
onset
medical
of the
attention,
disease.
later in the onset of the disease. So it's a kind of, see, I say that it's a kind of a thing that it blows inside you. It's kind of a thing that blows inside you.
Oh, okay.
And it can damage all your vital organs. So if you're late, if you don't get treatment in time, if you don't get appropriate treatment in time, in a good place, that will lead you to the
Right. So in July, you had told me that you closed that corona
we
unit.
successfully
You
closed the
successfully
unit.
closed it.
And,
Because we were winning.
I had doctors.
Pakistan was winning the war.
I had
corona.
doctors admitted, cardiologists. I had pulmonologists. I had all people from all walks of life, from parliamentarians to, you know, armed forces to, you know, all from, you know, people from low socioeconomic to high socioeconomics. We had contact with the embassies, that what if their patients are going to come. They used to, we used to give them the report. They had such a faith in us. And there were a lot of people that one time there was a coach who came from Bannu. There were 10 patients sitting there, said that you have treated one of my patients and brought 10 more. I said, where is the place? You know, why you brought them? So, and then one thing I did, that, see, we wanted that people should benefit from us. And what I did was that I asked my administration to give me another area. And it was kind of them that I built a separate unit. It was an outpatient unit, equipped with a good, you know, you call the recliner, the chairs, with oxygen machines, with the non-invasive ventilators, and you know, kind of AC and TV and all that. So I started seeing daily 15 patients in the morning, 15 patients in the evening.
Wow.
And those were the patients probably who could not afford, you know,
To be admitted.
Or I could treat them, and one of them who died. I don't recall anybody. They were in thousands.
That's wonderful.
That I was seeing in my clinic. Then every day I used to get messages. They used to say there is a magic doctor who just treats on the phone. Till Fajr, till Tahajjud, I was on the phone. One meal a day.
So round the clock.
One meal a day.
COVID
One meal
patients.
a day. Never had a sleep for more than 1 or 2 hours.
Okay.
Even with, you know, taking a meal, I used to get phone calls.
And this is the case with all your doctors and
all the
nurses of
doctors,
that
the
unit.
nurses, because they were calling you left and right.
Right,
You are
right.
the leader. If you don't pick up your phone, or if you don't answer them, see, this patient, sir, let's go and see this. Okay, what's going? Something happened. The patient is crashing there.
Yeah.
Let's go to the other room. That this is this. You know,
So you have to be available 24/7.
You are not available. You have to be vigilant. But
These are
good thing is, I
critical
lost a lot of weight also. I became more smart because of this COVID.
Because you weren't eating and you weren't.
And the other thing that I remember, but when I was in contact, I always thought that I had an exposure because with all the PPEs, with all the equipment, 5 of my best nurses were in the same unit where I was. So where they got it from?
So did you ever think you got sick?
Because you're high risk, you're high vulnerable, then you will get it.
Naturally.
See, there are spaces, there are things. See, it's a virus, see. And the load that you see, you don't know the patient was so sick, the load, the virus that they were carrying. And then you are in a closed environment. So I used to, when I used to get exposed, I used to count my days, what if I get sick, you know. And my CEO one day, he asked Dr. Salim Khan, he brought the nurse to take my blood and my COVID-19 testing. He said, why don't we do? So I said, if you do it, and if I'm positive, I have antibodies, I'm not coming back, then what will happen to my patients? See, if I get sick, what will happen? So, okay, that's fine, don't do it.
Okay.
And I think that I had 2 episodes of COVID-19.
Really?
Not
you were infected twice?
Yeah, I was infected. I could feel it because I was,
Wow.
and I used to, you know, kind of quarantine myself with the family, not telling them, just counting my days if I don't develop any other symptoms. And by the grace of God that I recovered,
Wow.
but I did not tell anybody. I stopped taking my temperature. I used to just, initially I used to come and my nurse used to take the temperature. I started avoiding them because if I get sick, then I knew that I will not be able to
care for those patients. Thousands
yes,
of patients.
you have to die one day, Sharmeen. But dying like this, I think that you'll be,
Right.
you know, you'll have the darja of a martyr. So that this was my profession. You know, when you say from the beginning, I said in my childhood, they ask you, why you what do you want to do? I said, I want to become a doctor. What do you want to do? Insaniyat ki khidmat. Humanity, take care of the humanity.
Yeah, humanity.
And you know, most of our elders used to laugh. You know, but this is it.
This
else
was the crunch time for you.
It was the crunch
Dr.
time.
Shazli, now coming to the conclusion of our discussion with you, I'd like to ask you, because now a second surge of COVID has started and you're thinking of reopening that unit for COVID that you had closed down in July successfully. All the patients had gone home safely and all. Now we're reopening because there's a new surge. What would you like to tell our public to save themselves and people like the healthcare professionals and all the exposure they have to undergo with this virus? How do we contain this? What are you seeing now? The trends you were saying are now younger and younger people coming in as opposed to elderly ones. So what would you like to tell the public?
Before I go and answer your question, I'd like to say one thing about, since you're doing a program on me. See, Sharmeen, a lot of people achieve what they want to achieve big in life over a period of so many years, span of 20 years, 30 years in their profession, legends, heroes, and you know, whatever. But I think what I have achieved in my life was in those 4 months. If you look back on my professional history of 30, 35 years, never in my life, this I think, till I die, I think this was the thing that I could do for my people, for
this
patients.
was your ultimate
I think this was within 4 months, and then there was other thing attached to it. If you do something in your life, except you know going on, you know, a war or something like that, this was a jihad because you could actually be one of them who are
you
martyrs.
could lose your life. Exactly.
You can lose. So I think that what I have achieved in those 4 months, I've never thought about it, and I probably won't be able to do this again because probably this will never, should not come back, inshallah. Something catastrophic.
Right.
So coming back to your question, that I think that this is a new wave that we were expecting. On 14th of August, when I closed the unit down in July, mid of July 14th, I was very happy. And I said on 14th of July in one of the programs, in interviews, one of the TV programs, that, you know, that's what we have given the nation, a gift, that it has been controlled, not it has gone. And there was always a chance that a new wave will come. See, you cannot put people behind the walls. You can do it for a certain period of time. You have done it. But man is a social animal. They have to go out. It's not feasible. When colleges, schools, universities, and these places where people go for their vacations, they opened up, there was a rush. And here people started, getting the infection. It's a very contagious disease. If one person gets it, it can give it to another 5, and 5 to doubling. See, doubling is more and more.
Exponential growth.
Exponential growth.
Yeah, right.
So it's highly contagious. So that's what happened. And now this is the phase that we were waiting, and we were afraid that this will come, and it has come back. And the good thing that I don't think so it's a good thing, because the government, the doctors were actually telling people through your media, through other channels, that you should still be wearing those protective, and some of those SOPs, very simple, washing your hands, wear a mask and all that, but they ignored. And the other thing that I'm now seeing, that this wave is targeting the younger population, and it is coming with a really fatal kind of a disease now. And most of the people that we are seeing not responding to any treatment. As I said before, there's still no treatment out there. There's no antiviral treatment. There is no vaccine till now. And the younger population is now being hit.
And it's more lethal this time.
It is lethal. The reason being, one, that probably this virus is now mutating. See, and there will be a big problem now that we'll be seeing if it comes or joins the influenza virus in winters. So you can imagine what catastrophe can happen.
So how do we protect ourselves?
So again, coming to the basics, that all along through your channels, through print, through electronic media, through social media, the doctors, you yourself, your programs, that the simple things were social distancing. And
don't attend the weddings and all that are going to start
even physical
now.
distancing.
Right.
See, we are sitting in approximate state, which is fine. And then wear mask, hand washing, simple means. So I think that those kind of things are the basically prevention. Prevention is better than cure, because there is no cure now. So I think that will be the thing that we should tell our people. And still, it's now doubling. It's coming back, and a lot of patients that we now I'm seeing the whole family getting sick. Like the 5 members of the family, they all come. One is the worst, and the some are less. And so you see a diversity also in the same family.
And the intensity of the
symptoms.
symptoms.
And the intensity of the disease. So I think that we should still be very careful about it, and because we don't have much health resources. We have a developing country. And the other thing is that, see, we were successful when all the people all around the world were seeing and focusing on Pakistan. What will happen to them? See, people were probably thinking there will be people lying on the streets and, something, a picture like that. As I said, the fear. But it did not happen.
It didn't happen, and we beat it,
so we
became an example for the world.
Well, so I think we should still be doing the same thing.
Right.
So we should be a kind of a name in the world. WHO has praised us. The other organizations have praised us. So I think we should still be in the limelight in the way that look at our neighbors,
Right.
So
Absolutely.
I think that that will be the best advice to our people.
Right, absolutely. Dr. Shazli, thank you so much for giving us your time today. We know how busy you are, because you're still seeing patients with the same number and intensity again, and you have, the hospital, your practice, everything like that. And I'd like to personally thank you on behalf of all of us in Pakistan and Islamabad for doing this great service for us, and thank your doctors and nurses as well, your colleagues over here, and all the doctors in Pakistan who've actually been serving everybody, the patients in the coronavirus pandemic, and their battle is still ahead. Today's program, I hope that you took away from this interview with Dr. Shazli Manzoor, he's been an achiever, he's been successful in his field, yet he decided at a critical time to serve his country and to serve patients, and that's such an important lesson to take away, where now we see selflessness in a person's profession, and there's so many doctors in Pakistan who've done that as well. We'd like to thank them all. And that brings us to the end of our program today, and I really hope that you've gained knowledge and insight from Dr. Shazli, especially about how to keep yourself safe in this pandemic. That's all for today for Sky's the Limit, and we'll see you the same day next week, same time on PTV World.